Assalamualaikum and hello. My name is Ahmad Irfan bin Zaidi and I am from MC11001A, and this video is for my pursuit speech of COM 165 subject. What is art and music therapy? Art therapy can involve a variety of creative expression, including drawing, painting, coloring, or sculpting to name a few, while music therapy touches all aspects of the mind, body, brain, and behavior. Music can provide a distraction for the mind. It can slow the rhythms of the body and it can alter someone's mood, which in turn can influence behavior. Art and music therapy decreases pain perception, reduces the amount of pain medication needed, helps relieve depression in pain patients, and gives them a sense of better control over their pain. What are so? Let me talk. So in this video, let me talk about what are the positive impacts of art and So in this video, let me talk about what are the positive impacts of art and music therapy to someone. First, art therapy. Creating art with an art therapist. First, art therapy. Creating art with an art therapist helps you express painful thoughts or memories, possibly related. Creating art with an art therapist helps you express painful thoughts or memories possibly related to your cancer diagnosis. This may help you cope with the diagnosis. In conventional mental health therapy, people talk with a counselor, talking about traumatic or painful experiences that may be hidden in the subconscious mind is an important part of the healing process. In much the same way, making a drawing or painting of an emotion or event can serve as a tool. It can help the art therapist guide you through the process of dealing with similar concerns. Art therapy is a body-mind therapy. Art therapy is a body-mind therapy. Many experts have seen and documented major benefits among people who have done art therapy, such as improved mood, fewer depression symptoms, and better overall quality of life. Doing art therapy or making art on your own can be an effective form of distraction as well. Thinking about and creating art can help to distract you from pain and anxiety. Many art therapists believe this type of therapy works, in part because creating art influences brainwave patterns and the substances released by the brain. It helps people express hidden emotions. It also reduces stress, fear, and anxiety. It can also provide a sense of freedom. Second, music therapy. Music therapy. Music therapy have two benefits, which is physical and mental. For physical, children and teens with cancer and other illness, the pain can be unimaginable and unbearable. and no matter how much medication is given to them, sometimes it just isn't enough. Therefore, music therapists suggest to listen and play music as well as songwriting and singing to help reduce the pain for the patient. Music therapy also can help to relieve pain and reduce stress and anxiety or Music therapy also can help to relieve pain and reduce stress and anxiety for the patient, resulting in physiological changes, including improved respiration, lower blood pressure, improved cardiac output, reduced heart rate, and relaxed muscle tension. When listening to this music, it is paired with deep relations through repeated practice. Over time, the music alone cues the response. The music therapy protocol is designed to perform several functions, such as direct attention away from pain or anxiety, and distracting the listener with comforting music. Provide a musical stimulus for rhythmic reading. Offer a rhythmic structure for systematic release of body tension. Cue positive visual imagery. Change mood and focus on positive thoughts and feelings, and to celebrate life. Third, music therapy in mental. Other than physical, there is the mental benefits. For young people in the hospital, simple being there can be a frightening and terrifying experience, let alone fighting cancer or another serious illness. One side effect of being in the hospital is One side effect of the being in the hospital is stress, which leads to anxiety, restlessness, lack of motivation or focus, feeling overwhelmed, irritability, or anger or sadness or depression that can change the patient's behavior, such as overreacting, angry outbursts, and social withdrawal. One of the best remedies for stress is music. One of the best remedies for stress is music. Music is often linked to moods, and certain songs can make individuals feel a variety of emotions, from happy, sad, energetic, and relaxed. Another incredible use of music therapy comes from helping children post-surgery. A research study from Northwestern University and Lurie Children's Hospital of Chicago found that listening to music and audiobooks is a viable alternative to medication for reducing post-surgery pain in children. Audio therapy is an exciting opportunity and should be considered by hospitals as an important strategy to minimize pain in children undergoing major surgery. Music therapy was also successful in helping cancer patients struggling with their treatment options. Patients who listen to their own music or work with a trained therapist experience a reduction of anxiety, pain, and their mood and quality of life improve. So the conclusion of my speech is therapy is well known for its problem solving techniques and a tool for overcoming anxiety and depression. In my perspective, getting therapy by listening to music or doing art with art therapists is very important, especially for the ones that are struggling with their mental health. Music therapy is the easiest way to reduce our anxiety, as we can listen to music anywhere and anytime. And for my final thought, there is no doubt that therapy can help improve symptoms of many mental health conditions. In therapy, people also learn to cope with symptoms that may not respond to treatment right away. Research shows that the benefits of therapy last longer than medication alone. Therefore, to those who need help, I recommend you to try art and music therapy. We have come to the end of my speech. So thank you so much for listening to my speech.